There has been a lot of research on exercise, and I'm not talking about the usual cohort studies or case control stuff that the media likes to pass off as causal when it's really correlative. I'm talking about randomized controlled trials. Take the effect of exercise on musculoskeletal disease. There have been 32 randomized controlled trials looking at the effect of exercise on pain and function of patients with osteoarthritis of the knee alone. 32 just for that! And exercise works. 10 RCTs have shown that exercise therapy can increase aerobic capacity and muscle strength in patients with rheumatoid arthritis. Other studies show its benefits for a host of other conditions, like ankylosing spondylitis and even some types of back pain. A systematic review showed that exercise therapy reduced all-cause mortality by 27% and cardiac mortality by 31% in middle-aged men who had suffered a previous heart attack. 14 more randomized controlled trials have shown the physiologic benefits in patients with heart failure. It even has clear lowering effects on blood pressure in patients with hypertension and can improve cholesterol and triglyceride levels. People with diabetes who exercise have better HbA1c values, which is the marker of glycemic control. 20 randomized controlled trials show that patients with chronic obstructive pulmonary disease can walk further and function better if they exercise. Exercise improves physical function, 7 randomized controlled trials, and health-related quality of life, 4 randomized controlled trials, in people who have Parkinson's disease. 6 RCTs showed that exercise improves muscle power and mobility-related activities in people with multiple sclerosis. It even appeared to improve those patients' moods. 23 randomized controlled trials showed that exercise can improve the symptoms of depression. 5 randomized controlled trials appear to show that it improves patients with chronic fatigue syndrome. It even improved fatigue in patients who have fatigue from cancer therapy. The basic recommendations for physical activity are 150 minutes per week of moderate intensity, or about a half hour a day, 5 days a week. What's moderate intensity? Walking briskly, say at 3 to 4 miles per hour or so. Bicycling, but slower than 10 miles an hour. Playing doubles tennis, something that would get your heart rate somewhere between 110 and 140 beats per minute for most people. Even vacuuming or mopping or mowing the lawn might qualify. Just walking from my office up and back to my clinic gets me the 30 minutes of walking that I need. Or walking to the supermarket from my office to grab lunch does the same. You can get to the mark pretty easily. Alternatively, you could choose to do 25 minutes of vigorous aerobic activity 3 times a week, 75 minutes total, and 2 days of strength training. That would also meet the recommendations. And that's what I tend to shoot for most of the time. We'd all be better off if we committed to adequate and sustainable exercise. 30 minutes a day, 5 times a week. We'd especially like to thank our honorary research associates, Cameron Alexander and Kadim Salah Mohammed. Thanks, Cameron and Kadim.